Welcome to Thera Talks with Dr. Shrestha. The risk factors for extravasation are indeed categorized into patient-related, procedure-related, and product-related factors. Patient-related factors: vein condition. Patients with fragile or damaged veins, such as those with a history of multiple injections or chemotherapy, are at a higher risk. Age. Infants and elderly individuals may have fragile veins, making them more susceptible to extravasation. Vascular disease. Conditions such as peripheral vascular disease can affect the integrity of blood vessels. Dehydration. Reduced blood volume and poor venous filling increase the risk of extravasation. Poor circulation. Conditions like diabetes can affect blood flow and increase the risk. Procedure-related factors. Site of injection. Certain areas, such as joints, tendons, and nerves, are more prone to complications if extravasation occurs. Needle size and type. Larger needles, especially those with a sharp bevel, can increase the risk of damage to the vessel wall. Inadequate fixation. Improperly secured catheters or needles may lead to movement and subsequent damage. Inadequate flushing. Failure to flush the line properly before or after administration may cause irritation to the vessel. Product-related factors: type of medication. Some drugs are more irritating to tissues than others. Vesicant drugs, which can cause blistering and tissue necrosis, pose a higher risk. Concentration of the drug. Higher concentrations increase the potential for tissue damage. pH of the drug. Acidic or alkaline substances can be more irritating. Osmolarity of the drug. Highly osmotic solutions can cause pain and tissue damage. An extravasation assessment tool that encompasses parameters such as color, intensity, skin temperature, edema, mobility, pain, and fever can be employed for diagnostic purposes. Management. At the first sign of extravasation, the following steps are recommended. 1. Stop administration of IV fluids immediately. 2. Disconnect the IV tube from the cannula. 3. Aspirate any residual drug from the cannula. 4. Administer a drug-specific antidote. 5. Notify the physician. 6. Elevate the limb with the extravasation site. And 7. Administer analgesic if necessary. Local cooling minimizes drug spread, reduce infection, and pain by contracting blood vessels. Apply cold fomentations 15 to 20 minutes, 4 to 6 times per day for 1 day or more. Local warming enhances fluid dispersion, absorption, and facilitates the removal of leaked medicinal fluid by dilating blood vessels. Apply hot fomentations 20 to 30 minutes, 4 to 6 times per day for 1 day or more. Preventive strategies. For peripheral venous access device extravasation. Avoid inserting the cannula in joints to prevent difficulty in securement and potential neural or tendon damage from extravasation with vesicant drugs. Avoid the antecubital fossa area due to difficulty in detecting extravasation. Use veins on the back of the hand for easier observation, but exercise caution to prevent severe injury from extravasation. Do not cover the cannula area with opaque gauze for effective observation. Secure the cannula firmly during drug administration. When administering vesicant drugs, secure a new route even if an existing IV route is present. If uncertain, consider reinserting the cannula before drug administration. Monitor for edema, inflammation, and pain around the cannula during drug administration. Check for blood backflow before and during administration, and rinse the catheter with saline between administrations. Dilute stimulant drugs whenever possible and administer at an appropriate rate. After needle removal, apply pressure to the puncture site for about 5 minutes and elevate the limb. For central venous access device extravasation. Prior to injection, check for blood backflow to confirm proper catheter placement in the vein. Assess for local discomfort or swelling by flushing the catheter with a saline solution before drug injection. Following drug administration, flush the catheter with a saline solution to ensure proper clearance. Thank you for tuning in. Stay with us for more exciting content.